Hello, you're watching continuing coverage of the World Healthcare Congress 2012 in Washington, D.C. I'm so pleased to welcome two gentlemen here from London. We have Mark Doughty and David Gilbert, and you're both co-directors of Patient Leaders. Well, please introduce me to Patient Leaders.
Sure. Patient Leaders is an organization that David and I set up about a year and a half ago, and it's focused on supporting patients, carers, and service users to develop the confidence and the ability to influence their care and also influence the medical system and medical organizations so that they are more attuned to what the patients, service users, and carers need.
I see. Now, may I ask you, that seems like a very, very important kind of resource to have for patients. It doesn't already exist?
It doesn't exist. What we found in our respective other businesses is that the NHS in the UK likes to think it listens well to patients and is responsive and improves their experience, but actually many of their efforts are done without the presence of patients at the decision-making table at local level. And certainly in our own personal experience, I'm a former mental health service user, there was no learning and support for people like us as we tried to become more influential in what we were doing. And we've noticed that professional leaders, medical leaders, managerial leaders, academic leaders have millions of pounds thrust into continuing professional development, and there's very little in the way of what other people call training, but we call learning and support, to build the capacity of patients to be an equal player in a strategic level as well as in their own care.
Well, traditionally the national healthcare system in England has provided just care to everyone, but is there also a movement more by private citizens to seek their own private care?
I think that is happening, but I think what's important is that the dynamic has always been quite a dependent relationship. So you had the professionals telling patients, this is what we can give you, and sometimes that really works. Sometimes that works when the care is really good, but sometimes patients and service users don't feel that they get heard, that they're not included in the decision-making process, that they want a partnership. They want to be able to sit with a medical professional and say, look, what would work for me? Can we talk about this together? Can we work? Can we collaborate? The trouble is, the skill base does not exist. So our job is to support patient leaders to become skilled in enabling others to have the confidence and the ability to have a conversation with medical professionals.
In concept, sounds fantastic and necessary, but in practice, do you have your work cut out for you? I mean, who are you training and what are you training them in? Okay.
So we offer a variety of learning programs. So we offer a 5-session, over a period of 5 months with coaching in between to people. They may be consumer advocates, as you might call them in the States. They may be representatives of patient groups. They may be people in the community who are health trainers, lay health trainers or coaches. And what we are trying to do at the moment is the people who are paying for the program are the institutions, so a hospital, a local authority, or a patient group who will send its members to our programs. And then Mark can talk a little bit about what actually happens on the programs. So the business case, if you like, is if these people, if the institutions and the community and the professionals and the patients can create a dialogue based on better relationships rather than polarized attitudes, then you've got shared decision making between patients and professionals, but also between communities and institutions and organizations, which we believe that if healthcare reform is to work, then if patients aren't driving that, then you'll always have one leg of the stool missing. You have the clinical leaders, the managerial leaders, without one leg of the stool with patient leaders, it's bound to fail. You're going to design systems that don't work for and with patients.
You've been in existence for about a year and a half.
Yeah.
How's it going?
It's going.
We've
reached a tipping
data
point.
that this is working?
Yeah, it's very strange. We seem to have reached a tipping point. Suddenly, a lot more people are paying attention to us and what we're doing. I mean, we've run about five sort of medically based programs,
and
two
others.
community based programs. And we've had about 80 or 90 people through, but we've also worked with about 300 others on 1 day, 2 day workshops. The evidence is that people are making significant changes. We are finding that not only are people feeling that they are able to make changes within their relationship within the system, but also we're finding that the skills and confidence that they have means they're making changes in their local community. They're becoming more active. So we have people going out into the community and proactively creating health interventions that are really supporting the community.
Okay. Well, I think we are going to look forward to getting an update next year.
Hopefully.
Thank
we look
you.
forward to
Thank
coming
you
back.
very
And
much.
thank you so
All right.
much.
Thank you, Mark Doughty, David Gilbert. Thank you so much. I'm Mabel Jong. Thanks for watching.